Spring. Today is Tuesday, February 13th, 18. I don't think I've been on many times since they changed the year. Anyway, I'm Fran Duvall, your host for today. I'm happy that our first guest in the studio will be the practice manager from the medical center, Crystal Estep. Estep. And we have our medical center director, Dr. Dar, with us. And good morning, both of you.
Good morning.
I bet you're kind of tired of all the attention you're getting right now, aren't you?
Yeah.
Depends on what kind of attention.
This is okay.
This is okay.
And hey, is that the reason the phones aren't working?
That's right.
Because you were getting too many calls at the medical center. It's been tough, hasn't it?
It has.
Yeah. How many weeks have we been doing this now? I've lost count. 3, 4?
Oh my gosh, longer than that.
Really?
Longer than that.
The flu, we started and I think January 2nd, first case.
I'll be darned.
Yes,
Yeah.
it was.
Yeah.
Well, and you know what? Some people have said, and I only found it out Monday a week ago, that they can swab for really identifying whether you have the flu. That often those symptoms are symptoms we get with other things.
Mm-hmm.
Maybe not all the aching and stuff, but anyway, I didn't realize until, as I said, last Monday, I was seeing Dr. Moalemi, and she was telling me she had gotten the flu. Oh. And then she mentioned, and they did a swab, and I, sure enough, and I said, a swab? And I didn't know about that. That's my ignorance. But I bet I'm not totally alone in that. Does the medical center do the swab for people who can be identified with the flu?
Yes, we does that, and it's called rapid flu testing, influenza A and influenza B for both. And it takes about 10 to 15 minutes to get the result.
Oh,
it's
that quickly?
Yes, it's very simple. We take a nasal swab or a throat swab, and there is a special kit for that, and we use that, apply the swab there, and some chemicals, and it gives us a report. But the problem with this is it's only 70% sensitive. So if your swab is negative, there is still 30% chance that you might have flu. Fortunately, so far this season, I have tested everybody who ever came to see me with these symptoms, and I didn't have any single positive flu test.
Okay. Well, that's encouraging, I guess, because you don't want to miss somebody, and et cetera. Yeah. Now for the GI, there's no test, right?
There is
Just
a test.
Symptoms?
There are two ways to identify norovirus. One is what we call Kaplan's criteria. Kaplan's criteria is based on the signs and symptoms. That's nausea, vomiting, abdominal pain, and incubation period of 12 to 48 hours, and the symptom lasting for up to 60 hours. And so if you are in a community and you are experiencing these type of symptoms in patients like this, then you assume that probably this patient is having this norovirus. But the for confirmation purposes, you take a stool sample and you send it to the lab. And the lab do a special technique called PCR. Polychain reaction. This is a genetic way. They find a small part of a particle of the virus, and then they have a technique to multiply that, and then they check the DNA and identify that it is norovirus or no. But it's not available everywhere. But our labs, I was told, we can do it.
Okay, all right. Okay, well, I hope that helped some people who might just not been in touch and don't know whether there's some way to definitively know whether they have these things, because often something we eat or whatever can cause some of these symptoms. So, Crystal, you have the task of managing that medical center. How's that going? You've been here for how long now?
7 months on the 10th it was.
Okay, okay.
Seems like I've been here forever, but in a good way. Everybody's so friendly, so you get to know them really fast.
Yeah, well,
So it's been
that's
nice.
good, that's good. So how are things going there with like staffing and those kind of things? And
Great. There has actually been a lot of change, a lot of positive change. We're still working on the flows of the medical center, what's going to work best for the residents and us as well. So that's coming along, but being fully staffed is one, so that's a good positive.
Right.
We have our CMA, Certified Medical Assistants, working with one provider a month at a time. They rotate between that and the front desk so that they're with that provider a longer period of time instead of daily, because daily we were placed in a CMA with a provider. So they were with somebody different every day.
I see.
This way they can get to know the residents, they can get to know the provider and how they work. So things run smoother and faster because every provider likes things differently. They practice differently.
Sure.
So in order for that to run smoothly, we want them with them for a long period of time. Another big change that has come across as wonderful is we have a certified medical assistant at the front desk with Krishna. So when people come in with prescription questions, there's somebody right there to answer them. If people come in with any medical question whatsoever, there's somebody right there to answer them versus Krishna having to get up and run to the back and come back up and give an answer. So it's been very convenient. And then the biggest thing about it is if one of the residents is in the waiting room and there's signs and symptoms of stress, you know, they can see that and they can bring it back to the room right away, whereas Krishna being up front, there's so much going on, you know, you just can't keep an eye on the waiting room as well. So that's been a major plus for us too.
Now, are you saying she's not in the front anymore?
Oh yeah, she is. You
She
think I'm
is,
removing
yeah.
her from the front?
You know,
Oh no.
I had the privilege of hosting when she and Faye White got their you know,
Shining
awards
Star,
for their
yeah.
Shining Star. And it's true. She is a jewel over there.
She is. She is. There's a couple people, and she was one of them when I first started it, that helped me through some processes that I didn't know, and she was one of them. She's very modest about it, but she is. She's a jewel. She's a great asset.
She really is. I've seen her work while I was waiting. Mostly I go for Coumadin tests, but I see her work with people. She's good.
She is.
She is.
Your lab people are good as well.
Thank you. We have a very wonderful team right now. They all pull together and work as a team. It's not that's not my physician. That's not my patient.
Well,
they're all a team, and it's hard to find that. It's
Yeah.
really hard to find that, and we have found it.
Well, part of that certainly would be the leadership and having people know where the boundaries are and what, I mean, that comes with your job.
Well, thank you. I believe I'm part of the team as well, and I reach out to them for suggestions because they're the ones on the floor. So a lot of the changes are made by all of us. We discuss what needs to be changed, what workflow would work better for them. So I just consider myself part of the team.
Good. We're glad to have you.
Well, thank you.
I've been here
glad to
for
be
15 years now, and so I've seen a couple of the managers leave for better jobs or whatever, you know, which I change jobs a lot myself, so I can't fault anybody on doing that. So is there anything significant today that you want to address? We have a number of minutes left.
There's a couple things I would like to address, and Dr. Dar, please chime in. For the GI symptoms, one of the things I would like to address is I'm hearing when I'm in the front or from podiatry, people will call and they said, well, I just got done being sick, because they'll ask how they're doing, and it's only been like 24 hours and they want to come in for a podiatry appointment. Please, we need to make sure that you're symptom-free for about 48 to 72 hours before you start making appointments or coming down to get your feet done or actually mingling in the community as much as you did prior, because you still have the signs and symptoms, you're just not really feeling them. It takes about 48 to 72 hours after your last the last sign or symptom
Yeah.
to be clear. So make sure to be mindful of that, even though you feel good, it just might not be done yet, so that we don't pass it along.
Right.
The second thing I want to mention is, I know we talk about insurance cards a lot. It is a new year, so a lot of people have been bringing their new insurance card, although we will be sending out some information when this happens, but in March, Medicare is going to change their the Medicare numbers.
Right.
They're going from Social Security numbers to a whole different number. So when that does happen, we just ask that people bring the cards down
Sure.
so that we can do the billing correctly. But a lot of people, if they don't get the information, it's not going to know that it changed, and it's been your social for so long. So that change is coming up. That's going to be a big
I understand
change.
we're going to get like plastic cards
Yes.
too, instead
Yes.
of paper. You know, one thing I haven't heard mentioned from the medical center or anybody is going to the hairdresser. Women particularly, you know, could be on death's door. And they got to have their hair looking nice. Don't you, isn't the salon, I don't want to close the salons. My God, I'm waiting to get everybody well enough to get my own haircut. But is there some, are you cognizant of that?
Actually, when we say please isolate and practice contact precaution, that includes not only the hair cutting salon, everywhere. We don't want to discriminate between anything.
No.
So,
exactly.
so probably it's better for the community and themselves. One more thing I will add to Crystal, that if you have any symptoms and you came for the podiatrist, please call the security, because we have a system developed so that they call the security and security inform us, and we keep a record that who is sick and how many patients are sick.
Yeah.
So everything should come through that, because this is an epidemic type of thing. So it is very important to know how many cases
Sure.
are coming and where are they coming from. So if they come from different sources, it will be a problem.
Okay. We're out of time. Thank you very much for coming today and
You're
giving
welcome.
us more information.